Go.
All right, so our patient for the day is Miss Sophie Lynn. So she got some gabapentin and trazodone on board, so hopefully she will cooperate for this. So we have Miss Green here. She will be restraining Sophie. And my job is to be placing the catheter, but I also have to hold her leg forward, okay? So we're going to pretend like this is going to be a soft tissue surgery. So we're going to grab our soft tissue surgery clippers, and we're just going to shave this area. It'll kind of be like a wide rectangle, okay? I always like to tap this on the patient's arm so they don't get startled and scared, and they're used to that feeling, the vibrations. And you want to make this a very pretty shave job because the owners will be judging you. All right, let's take a look at what we have. So I think that looks good. I'm just trying to get rid of some of the excess hair. And I can tell already that her vein is right here. Sometimes what you can do while you are placing the catheter, or before actually, I like to bend the wrist because it'll make the vein pop out a little bit more. So we're going to start our dirty scrub. We're going to start with chlorhexidine first. I'm just going to do one swipe. You don't have to go back and forth. That will irritate the area. Then we're going to move on to alcohol. I'm sorry. Now it's the clean scrub. I'm sorry. She doesn't like that. This is our second set of the clean scrub. Last set. Oh, I'm sorry. And then using this little towel right here, we're just going to dry the sides of her little arm. It's also not a bad idea to dry your hands as well. So I'm going to bring my supplies to the table. I am going to grab my 22 gauge catheter right here. I am going to grab my flushed T-port, and I want to make sure my tape is close to me. I'm going to open this, and my hands are wet. I'm letting go, Miss Green. Okay. Okay, so you always want to make sure we have bevel up on the catheter. I always like to loosen this up. I also like to loosen this up just a little bit so it is ready to go. Not all the way, just a little bit. Okay. Bevel up. No, Miss Sophie might not like this. So we're going to be poking. And look at that. That's my flash of blood right there. And can you see that the blood is also flowing? That is what you want. So I will advance my catheter. Miss Green is going to place her thumb right on top of the insertion site. Now I will connect my T-port. There we go. Oh, Dawn, good girl. Okay, so go ahead and look at my hand. Your job is to keep your thumb on this portion of the T-port. I like to use my index finger for support during my tape, which you will see. And then my other fingers are holding onto her little paws. Okay, now I'm going to grab my first tape. So from left to right is the order of the tape. All right, so this one is going to be sticky side up. I am going to lift the T-port and I have to slide my tape all the way at the top. So right at the base, close to the insertion site right here. So again, sticky side up. I'm gonna roll my tape to the left, and then I'm going to wrap it around her little arm. And she's doing so good. Oh, it's okay, I'm sorry. I like to give it a little pinch to secure the tape. Then I'm gonna go to grab the second tape. This is the one with like the little V cut. This one's a little bit difficult to do as you're holding on to the leg. I'm gonna slide that all the way to the top, and it's sticky side down. Ooh, the good girl. Gonna wrap the tape around her little arm. Now, when I wrap it around, I don't want to mess with this portion of the T-port, so I'm gonna cover only this. Make sure this is nice and secure and screwed on. Again, give it a little pinch. Now what I want to do is I'm going to grab my flush. I want to make sure that my catheter is patent. So I'm going to connect my needle through the little yellow rubber stopper. Now when you push, do not do these little small pushes on the plunger, because then your restrainer will not be able to feel that.
Perfect.
Good. And I'm just going to give her all of it. I will continue with my taping. Now I'm going to grab the third piece, which is the smallest of the four. And my goal is to do, people call it an upside down chevron. People call it a little bra strap. I call it an upside down breast cancer symbol. So sticky side up. Okay, and I'm going to wrap it around this portion of the T-port. Not sure if you guys can see that right here. So just like that, I wrapped it around the T-port. Give it a little pinch so the tape is nice and secure, and you did good, girl. Okay, now I have to secure this piece of the T-port. The goal is to have it like this, okay? So I'm grabbing my last piece of tape, and I am going to wrap it around the little wings of the T-port like so. I do not want the tape to come in contact with this, because once we remove the little white piece, we have to set it down, and that is where our fluids will connect. So sticky side down, I kind of just wrapped it around itself like that. And my goal is to also not mess with this up here. That's it, we're all done. All right, and then just to confirm that the catheter is still in, I'm gonna flush it again.
Perfect.
Good. All right, and that is how you place a catheter at Carrington College.